Welcome to the fourth video of this series related to social accountability in health professional education. My name is Mohamed Hassan Taha. I am a physician and a medical educationalist with the passion of advancing uh, health population through education and particularly through advancing social accountability. In this video, we'll be talking about this is the fourth video of the series related to social accountability. And the previous three videos discuss the community-oriented and community-based education, discuss the concepts of social accountability, principles and values, and discuss how to evaluate the compliance of educational institute with the social accountability principles and value. Today, and in this video, we will be talking about instilling social accountability into medical curriculum. This presentation basically from the AMI guide we published recently about instilling social accountability in health professional education curriculum, AMI guide 175. I highly encourage you to read this AMI guide. You'll find more details, and also from this chapter, embedding social accountability into medical curriculum, from our book published recently, Social Accountability of Medical Schools, Empowering the Future of Medical Education and Healthcare System. To start the session, let us start with the expecting role of medical educator or the medical doctors. Now, the expectations of the community has changed from before, and the community there's a new expecting role for the doctors and healthcare professionals. By the community, the profession itself, there's main advancement and the healthcare system. And if we look at, from our perspective, when we look at the competent physician or competent doctors, and how do the community actually see a competent doctors or a competent physician? It's very important to mark between the two. And it's very important to include the community in the planning of the competencies and the development of the competencies of the graduate. And if we look at what we produce to the community, there is a disconnect. Medical students excel in clinical skills, but struggling in community engagement. And most of the traditional curricula emphasize hospitals, not the neighborhoods. And the result, graduates who treat disease but not the determinants of the health, as you can see here, this example of the determinant of the health. So I want you to ask, where in your program do students learn about why is my patient sick, instead of only what disease does she or he have? And I encourage you to read this AIM guide related to integrating social determinant of health, where you can see the impact of this social determinant of health and how we can change or evolve the curricula or improve the curricula so that to address these determinants. Let us review the values of social accountability, which is relevance, quality, equity, and cost effectiveness. And in education domain, for the relevance, what is the best role for doctors? What is the best thing to be taught to the our students today to make them responsive to the community when they graduate? And for the quality in education domain, collaborating to address the social determinant of health. All faculty, all admin, all support, we need to work together on that. And for the equity, we need to consider the minority recruitment and placing graduates in health professional shortage area. And for cost effectiveness, we need to promote a primary healthcare model for cost effectiveness service and also for education. And as Buja said, physicians must not just fix into the broken system. They must change the broken system. And we need to redefine excellence in medical education. And these with the shifting purpose of medical education. So, from training individual clinical excellence to preparing health professionals responsive to population needs, and from academic isolation to community partnership and co-creation, and from assumptions about what community need to evidence-based understanding of priority health concern, and from measuring success by research output and prestige to demonstrating the community health impact, and and these very important things that need to be considered in when we define excellence. And excellence actually must be measured in the societal impact. I brought this slide again here in this video to highlight that in order to instill the social accountability in the curriculum, in the curriculum team in the medical school, they must anticipatively identify the society needs with the partners, and they work with the society or the community to develop the outcomes. The program should be context to the context, and they need to think about how they can make the graduate as health system agents by having a better understanding of the health system, and they need to focus their evaluation on the impact and to bring external, not only the external, to bring health partners to assess the students and to assess the curriculum. There are many frameworks that can be developed or can be used to instill social accountability into the curriculum. The easiest one and the common one is the 6-step approach by Kern. Start by problem identification and the needs. And in the AMI guide, we have described this with the case study, then having targeting need assessment to the learners, development the goals, educational strategies, implementation, and feedback. And for the needs, we need to think about the needs of the community. And for the goals, social determinant of health should be part of these goals. And for the educational strategies, we need to utilize community-based education, community-oriented education, service learning, interprofessional education to advance social accountability, and rewrite the cases in problem-based learning to instill social accountability there. For the implementation, we need to think about not only implementing the curriculum inside the class or hospitals, we need to consider the community placement. And the feedback, for the feedback, we need to consider the stakeholder in the feedback. So let's go deep. Social accountability in the curriculum. In the macro level, at the committee of the curriculum committee or people working the curriculum, we need to instill the values of social accountability in the graduate competencies and trustable professional activities. And at middle level, we need to do curriculum mapping and to make sure that the social determinant of health and these values are mapped and integrated and instilled, embedded in each part of the curriculum. And for macro health level, we need to see which impact that our curriculum will do in the community after 5 years from now. I will review this again, the 6-step approach here. I brought this from the chapter about instilling social accountability in the curriculum. The first step is identification of the needs, the health needs. Then developing competencies of the graduate as a key agent. This is very important. This is for the target need assessment. We need to work on that. We need to revisit the goal carefully. This is very important thing that need to be done with the stakeholders and for the institutional, for the instructional and educational strategies. We need to think about which strategies that we should follow and which teaching and learning approach that we should follow and for the evaluation again. And in order to do this, the good approach that we should follow the co-design approach. For the need assessment, we need to conduct a systematic community need assessment with all stakeholders and use framework to collect the data and align this data with the national needs, regional needs, and so on. After defining the stakeholders, we need to to do the stakeholder mapping for their interest and for their powers, and to decide who should be involved, who should be consulted, who should be included, and who should be informed. It's very important. This is related to the level. Inform, consult, include, and involve. Then we need to define the scope, social accountability scope. Inspiring by the mission, inspiring by the needs of the community, the populations, the measurable goals at country levels, we need to design the scope, decide the scope of this instill or embed. And we need to ensure alignment with the policy of the accreditation and the goals. When it comes to the design, again, we have to think about the co-design approach with the community, health system partners, embed a social mission into the learning objective and outcomes, and integrate public health, primary health, ethics, equity, social determinant health across the curriculum, not only in community medicine courses. And we need to involve the NGOs, non-governmental organizations, and patient groups, maybe society, patient associations, in like field project, mentorships, and storytelling programs. These could be a helpful example in co-design approach. When it comes to the teaching and learning methods, again, surface learning, community-based learning, longitudinal scholarship in underserved area, and teaching interprofessional educations, for example, social worker, community health workers, with medical, nursing students, and so on. And we can leverage also technology, including the telehealth and so on. Going back to problem-based learning, we have, in 2020, we have developed this inventory related to the to evaluate the social accountability principles in case scenarios using problem-based learning. And we have actually evaluate the integration of the social accountability values into the medical education using problem-based learning in one of the medical schools here, University of Sharjah in the UAE, and also we work with a colleague from Suez Canal, and we measure the compliance at the Suez Canal, and this has been published. And also one of the key researchers, Dr. Mohamed Hassan, he worked in Ireland, Limerick, and also published this, and we validated this tool across different countries. It's very important not to forget the assessment and the assessment because assessment is derived learning. So we need to go beyond measuring the classroom learning outcomes. We need to go beyond the classical assessment tools to integrate assessment tools that can advance social accountability, such as reflective portfolio, community-based project evaluation, OSCE, station, social medicine. We need to track graduates' practice, location, and community health outcomes, and to integrate regular community feedback into curriculum design, and to use assessment finding to continuously improve the program and learning outcome. Thank you so much for watching this video about instilling social accountability in the curriculum. I highly recommend you to read the AIME guide and other relevant chapter related to this, just as a snapshot or just shedding the light on how to instill social accountability into medical curriculum. It's very important to highlight that without faculty development, change will not be possible. So the next video will be about the role of faculty development in advancing social accountability in medical education.